Okay, so I think it is now 8:45 in the morning here in the UK. So we shall make our start. Assalamualaikum warahmatullahi wabarakatuh, and a very good morning or good afternoon, depending on where you're listening from. My name is Azlin, and I'm one of the junior doctors here in the UK, and I will be your MC for today's session. So just to make sure that you are in the right place, this is the Foundation and Internship webinar, also known as the FIT webinar of 2021, organized by the Health and Wellbeing Cluster of ICRAM United Kingdom and IO. And shall I just double check whether or not we are live streaming? Yes, we are. So we are simultaneously being live streamed on YouTube. So for those of you who are also tuning in from YouTube, welcome. We have only just started. Right, so this is the third year running that we are organizing an online webinar catered for newly graduated or soon to start doctors that will be starting their jobs in August, primarily for foundation doctors and also interns in Ireland. This year we have rebranded it and called it Foundation and Internship, just to include our colleagues in Ireland as well. And we hope that you will gain a lot of benefit from today's talk. So just a bit of background. So the Health and Wellbeing Cluster is one out of 6 clusters under ICRAM United Kingdom and IO. And this cluster aims to provide a platform for medical training initiatives, as well as nurture a holistic, health-conscious society as a whole. And today's webinar is one out of many online webinars under the Dear Doctor series, an online web series by doctors for doctors in the UK and IO. And in the past year alone, we have organized many webinars under this series, and our most recent one being a talk on less than full-time training in the UK, delivered by 2 of our own members. And last year, we have also organized online talks and workshops on specialty training, and which we received quite positive feedback from those as well. And if you've missed our previous webinars, feel free to follow us on our social medias for you to find out a bit more about that. And we hope you look forward to our future events as well. Now, just a bit of background on today's event. What we will do is that we will try our best to provide you with tips, tricks, as well as the tools that you need to sort of hit the ground running on your first day working as a doctor. I know it can feel a bit intimidating or feels a bit strange, to be given the responsibility to look after patients after years of spending time in medical school. But we will try our best to provide you with enough information, and hopefully you will find benefit in it. What we will not do, however, we will not be including the steps on how to apply for a job in the UK and IO. And we will also not be going into detail on how to apply for specialty training after foundation and internship. So that will be potentially a separate talk. So do look forward for our future sessions. Right, so just a few sort of housekeeping rules. So the first thing is, if you've noticed that we've muted everyone in this webinar, so that's just to make sure that our session runs smoothly with no interruptions and that we can start and finish on time. Then throughout the entire talk of each speaker, feel free to ask your questions in the chat box. If you're on Zoom, however, if you're tuning in from YouTube, then feel free to ask your questions in the YouTube chat box. Our committee members will be on the lookout for those questions. So at any time, feel free to drop any questions or concerns, and we will try our best to sort it out. Our committee members have also sent an e-booklet for those of you who have registered via Eventbrite. Do check your emails. If it's not there, it might be in spam. Or if you have any problems accessing the files, drop a message in the chat box as well. It's mainly just a sort of brief summary of what we're doing today, as well as a little space for note-taking as well. So that's the second bit. And So each speaker will have 30 minutes to deliver their talks, and that will include question and answer as well. So if we do have time within the 30 minutes, we'll try our best to get the speakers to answer your questions within that 30 minutes. But if we run out of time, we will keep it at the end of the webinar. As you can see, around 12:30, we will try our best to aim and answer all of your questions. What else? Right. Let me just double check to make sure that our first speaker is ready. Brilliant. I think our first speaker is here. So for our first session, because we have got participants who will be starting either foundation training or internship in the Ireland, we have separated you into two groups, and both will be happening at the same time. So for those of you who will be looking forward to listening about foundation training, please stay in this main room. And if you are looking to listen on the internship part of the talk, we will be putting you in a separate breakout room where an Irish trained doctor might be best to answer your questions, if that's all right. But before you go, I might just introduce both of our speakers before we go into separate rooms. So our first speaker is Dr. Ariza binti Ahmad Bahtiar, and she's a clinical fellow in medical oncology at Charing Cross Hospital, United Kingdom. And she has recently completed her foundation training in East Midlands, United Kingdom, not very long ago. And she will be the best person to talk to you about a day in the life of a foundation doctor in the UK. So that's our first speaker. And our second speaker is Dr. Hijaz bin Adnan, and he is currently a medical registrar in Blackrock Clinic, Ireland. He has a special interest in neurology as well as academia and research, and he's currently working towards an MD via the STAR program under the Royal College of Surgeons in Ireland. And he will be talking to you about a day in the life of an intern. So while we sort out your breakout rooms, feel free to grab yourself a cup of tea if you haven't, or grab yourself a piece of paper to write notes on, and we will start shortly once everyone is in their respective rooms. So you will potentially see a little pop-up box that says whether or not you can go into a separate breakout room for those of you who are listening to Dr. Hijaz. And if, say, you decided to move between rooms, but and you decide to listen to the foundation bit as well, you do have that option either to stay in the separate room or go into the other one. So we'll just give it about maybe a minute or two for you to choose your rooms, and then our speakers can get ready. Right, for those of you who have just joined us, so there will be the first speaker. So the first talk will be divided into two, and both will be happening at the same time. So for those of you who are looking to listen to the foundation training bit, which is in the UK, so stay in this room. But for those of you who are looking to listen to the internship part of things, do stay in the breakout room. And then we will meet back in the main room, which is this area, in half an hour for the next talk. That makes sense? So there should be a pop-up that asks you whether or not you want to go into the Ireland room or stay in this one. So we will try our best to record the Ireland part of the morning as well. And that might be uploaded at a later date. We shall see how it goes. Okay, shall we get the presenter, Dr. Ariza? So I'm assuming everyone in this current main room is for those of you who are looking forward to listening about foundation training. So I'll hand over the screen to Dr. Ariza. Feel free to share your screen and start whenever you're ready.
All right. Hello, everyone. Just let me get it set up first. Can everyone see these slides?
Yes.
Awesome. Okay. Right. So let's start, shall we? All right. So as an introduction, my name is Ariza. You don't even have to call me doctor. We'll go informal on this. My name is Ariza, and I have just arrived in the UK about 3 days ago. I was previously in Malaysia for about 11 months doing about 2-3 projects at home. We'll talk about that later. But and I'm happy and humbly grateful that you guys have UK Ireland team has invited me to give this talk. It's been a while since I've left the foundation program. I mean, like about 11 months, but I can talk to you about a few things. So let's get started. So the content for today is introduction, the pre-first day, the first day and so forth, the joys, the sorrows, and all the love plus tips. So my headings are not very conventional. It's more of like to get you to be more approachable. That's okay. So you've graduated as a doctor. So I graduated on a bit more introduction to me. I graduated on the 30th of June, 2018. It took me accumulation of these years to get to this point. I was born and raised in PJ, so I went to school in Kampung Tungku. I went to SMKP Sriaman, which is also in PJ, and I went to College Marabunting. I did my IB there, and then I went to Queen's University Belfast, and I studied there for 5 years. And a little bit myself as well. I'm the eldest of 5 siblings. My mom and dad is in these pictures, and my second sister is doing her chemical engineering master's in France. My third sister is doing ACC accountancy in Scotland, while the youngest two are still in school, so primary and secondary school. My husband is a mechanical engineer, graduated from Malaysian Japan Institute, so he's a research assistant as well in the university. Let's just move on. So what do you have to know about foundation? So generally foundation, well, in Malaysia we call it housemanship. So I chose to be in East Midlands primarily because I was following the steps of my seniors. my seniors were, I think one of my seniors was in Nottingham, and I asked her, oh, what is it like to be there? Is it approachable? Is it a good rotation? Is it a good environment to be in as a junior doctor, basically? And was it close to home? That was the question. And what I meant by close to home is, do I have people that I can talk to, or do I have someone with the same roots, like a Malaysian primarily? And finding out there's more Malaysians there, and feeling that I need to be out of my cocoon, which is in Belfast, I chose Nottingham. So I got offered at Nottingham City Hospital, and there were things that I have to do. It was very overwhelming because not only I have to prepare the documents, go through all the visa and immigration, you have to also think about moving. So myself, I was moving from Belfast to Nottingham, so I still need to take a flight. Whereas some people, for example, those who are starting their foundations in UK, they might be coming from another country or moving from another country. So you might want to think about timeline and pack and luggage, and also arranging time in terms of flight. And now with COVID, you got to think about whether you need to be quarantined and when's your swabbing test, vaccination as well. So that's a whole package there. And so what I meant by pre-first day madness was there was a lot of things to do, and there were different deadlines. So it can push you to the edge, but it's best for you to have like an organizer. See, I'm old school. I love a good journal. I always change my journal every year, and each journal there is like each month dates and the dates, so you can actually start to note down. Take one day and go through your emails from the trust and see what you need to do by each deadline, and then you can see the pattern on like, oh, when should I start doing my visa, when should I start applying my NI number, which you need to when if you want to work in the UK, and when should I arrange for an appointment to do my ID. So these things you need to start noting it down and look at when you can submit it. It's all about timeline. And in terms of online courses, so each trust have their own set of modules that you need to finish by a set of time. So sometimes, like for example, in Nottingham, they want to encourage you to to finish the courses before you start your job. They will give you 1 day off in lieu. So I obviously want a day off to my annual leave. So I finished the course, the set of course before I start the job. So these courses are not like you have to go there. Some courses, yes, but not necessarily. So the courses that you must do is mostly online assessment. They normally teach you on fire safety, on each trust system. So then, for example, in Nottingham, we have notice for discharge letter, and we have nerve center to order certain tests and investigations for patients. We have the imaging center. So these are where and how you order the radiological investigations, such as X-ray, CT scans. So these courses are to make you familiar on how the system is running the hospital, basically. And then you have things like moving and handling courses, and you have things like prescribing course. So each trust have a different, let's say, Cardex, a drop card, and each trust have different ways to approach in terms of how you prescribe things. So you have to make sure that you familiarize yourself with the online courses. And each course will have an assessment. It will be 3 times of try. So normally you will get the first attempt correct. So it shouldn't be a problem. The next thing is you need to book. So for foundation doctors, you need to book courses like that is mandatory for you to pass your ARCP. And these things are not necessarily you have to book before you start your job. You have a bit of a time, but again, as I said, when you start working, there's night shift and other stuff, so you kind of need to be aware of timeline. When are you able to go for your course? And sometimes this course are not even in the hospital. You have to travel a bit more to get to the course. So you need to check on the requirements of your ARCP and what course you need to get yourself booked in. So in terms of moving, it was kind of hectic because I was moving alone to Nottingham. I didn't have people from Belfast moving to Nottingham, so I was already arranging boxes and separating things to bring here and there. So you need to be more organized in terms of which is about your logistics and everything. So that is one thing. And because I'm a family person, after graduation, I went back home for about a month or two. And then I came back for travels with my family. And then I sent them at the airport, basically send home, because I'm not sure when else I'm going to get a long period of time to be with my family once I start working. So it was the perfect time for me to spend some time with my parents, with my sisters, before I start the job. It was sort of like a support booster for me. Okay, let's just move on. And I also need to think about, because moving from one place, you need to find the geographics of the location. How do I get to work? Is there a shuttle bus? So luckily for me, I went onto Facebook and I went to the Nottingham Malaysian Society and I asked around if there is a room to rent in an all-female accommodation, or was the staff accommodation worth it for me to to apply? So I was very fortunate, alhamdulillah, that I got a room with 2 girls, Malaysian students, and it was easy to deal with because it was direct with the owner rather than an agent. So that was one hurdle out of the way. And again, you yourself need to kind of survey 2 to 3 months before you start moving to that place about where you want to live and documents needed for a tenancy agreement. So that's another process that you have to go through. And then I was looking at the maps on how long for me to get to the hospital, because you have to think, being a woman yourself, or a man, apologies, that if you were doing your night shift, was it safe for you to walk? And if it's not safe, is there any other modes of transport that you can use? So it was lucky for me because my rented house was 5 minutes walk to Queen's Medical Center. And then from there is a shuttle bus that runs every half an hour to get to Nottingham City Hospital. So it was very lucky for me to actually get into Nottingham. And then, well, this wasn't the big question, actually. It was more of like, what should you wear? But it was just meant to be a joke. Anything that's comfortable and formal is fine. You don't have to be so formal, but you need to make sure that what you wear, it's convenient enough for you to run around. Your shoes have to be, I would say, comfortable. I think shoes is a very important thing, because if you were to run around managing acute patients, you need good shoes. And then you need to have, attire that suits when you do acute stuff, like, be in an environment where you have to be involved with an acute arrest. And as F1 in Nottingham, you have to hold arrest Bleep. And I'll talk about that later. So again, I said book your mandatory online classes or assessments like resuscitations, ALS and BLS, all that stuff. And this is actually part of the GMC guideline. You have to have an MDU to protect you. So it's part of the requirement, and you have to pay monthly for your fees, and then you have to have this actually. It is a mandatory thing. You have to also book a GP. That is also under GMC requirement. And if you find out that you do not have 2 of these, you will be called for interrogation, and your license might be suspended. BMA is a good form for you to get involved in research, because it has a lot of ways to increase your CVD points, as well as your link to journals and articles. It is also good for example, if you feel like you're not getting the right amount of leave, or you feel like your trust is somehow not very kind in terms of your rotation, you can have advice support from BMA, and they will advise you on how to proceed in terms of putting in a report. So it's actually quite good for you to have this, because it's also quite good if, for example, you feel that you're being bullied. Well, another story to tell, you can send a report to BMA and they will advise you on how to proceed actually. And this last part was very funny because I annually battlefield. So of course we all want to go home, Malaysia or wherever home is. So you still have to fight for it. So with an environment where half of my team is Malaysian, in my rotation, at one point I have to, when are you going to take your leave off? So can I swap with you? So you need to be, so if you want to take a 14-day leave or like a elongated leave, because you only get 9 days for each rotation, and you want to elongate it, you need to time it really well. For example, after night shift, there's about 3-day post call, and you take that 3 days plus 9 days of annual leave, and then you have to make sure that the ward is being sufficiently staffed as well, or else they won't approve your leave. So it's quite of a Minecraft situation actually. So when you went to first day as a doctor, normally you don't go straight to the ward. You will have an induction. So this induction is usually 2 to 3 days. It's basically a talk where each of the hospital department will come in to the talks and give you what you need to do and what numbers are you supposed to remember. And for example, for a junior doctor, you're still baby doctor. They cannot put you with so much responsibility. You're still under probation, that what people might say. I remember when I was in induction, the hospital night coordinator said you're not supposed to deal with post-grad acute receiving unit. For example, like in Nottingham, you have the oncology, infectious disease, and hematology. We're not supposed to handle these wards post-call. These are for F2s. We don't handle renal as well, and we don't handle cardiology unit. That is in Nottingham City Hospital. We only handle the respiratory receiving unit. So basically, we only handle things like acute med ward, and we'll do ward jobs. You'll find out what your responsibility is as soon as you get to the ward. But the first thing you do is find out during on calls, what is your hospital at night coordinator. They are the big boss at night, and during your on-call hours. They will help you and support you, and they will link you to more doctors. For example, if you're swamped, there was one time I had to handle the whole of acute medical MEU, so acute medical unit, by myself after 5 p.m. because they messed up the rota. So I called them in and said that I need more support. I need more support here. I'm only an F1 covering this whole MEU. So they sent me to more doctors. They'll pull in doctors from other ways to help you. So you need to know when to ask for help. And it's not a shame to ask for help. You also need to know your medical registrar. They are the big boss as well during on-calls. They will be the one handling acute arrests, acute unwell patients, and they're only, so the medical registrar covers the medical bits and the surgical registrar covers the surgical bits. So you need to know their numbers specifically. And then you need to know when your deadlines for appraisals, usually around June, and you need to know what kind of requirements to pass. So maybe, for example, you need 30 hours of learning time, and you need to do any other mandatory courses. You need to be aware of your covered areas and duties during on-call. As I say, you need to know what F1s are supposed to cover and not supposed to cover. Sometimes they can be a bit cheeky, especially during the first day of as a doctor. Sometimes they are a bit cheeky, and you need to be aware. And you need to know about your limitations as well. You're an F1, you're a doctor, doesn't mean you're expected to know everything. You're just starting to get used to the environment first in the hospital. It's a bit daunting, but you'll be all right. So these are pictures. So I've taken this picture during my first day. I was really scared because I wasn't sure what I was supposed to do for during on-call. So I was really holding on to my hospital night coordinator. So these are, I'm not sure whether these are the current numbers still for Nottingham City Hospital and for Queen's Medical Center, but these are my the big boss during at night or during on-calls. And this is Queen Medical Center and Nottingham City Hospital. So Nottingham City Hospital is more towards a specialized unit hospital, whereas Queen's is more like the big general hospital. It was much more calmer to do on-calls in Nottingham City Hospital, in my opinion. Whereas in Queens, it was just a bit havoc because it is the primary emergency hospital. We don't have emergency unit in the city hospital. So it's a bit more calmer in the city hospital. So let's move on. Let me know if I'm too fast. Okay, so my rotations for foundation year 1 was renal medicine, infectious disease and medical microbiology, and general surgery. My second foundation years was trauma and orthopedics, healthcare of the elderly, and general internal medicine. I was supposed to do GP, but because of COVID, they have put me into acute medical ward, acute medical unit basically. So these are things that I think are quite important. So you need to know your team. So each ward have a different system that they work on. They have a team of nurses, staff nurses. They have a team of sister, deputy sister. They have the receptionists. They have the ward doctors, which is you. You have the consultants and registrars, and you have their own. So for renal medicine, let's talk about renal medicine. You need to know that they have a dialysis unit. They're considered very unstable patients. You need to know that they have a designated renal registrar that has to be on the ward in case anything happens, because renal is quite an unstable specialty in terms of they are easily becoming unwell. I remember on my first day, someone was having a DKA, an end-stage renal failure with GFR of 6 was having a DKA, and according to the protocol, for normal DKA people, you have to flush them with lots and lots of fluids. But for renal patients, you are not allowed to do so. So they have another separate protocol from what we learn generally in the hospital. So these things you need to know, and it's not shameful to ask your registrars. You need to ask for help because renal patients tend to be deteriorating quite fast. So you need to know your team basically, and it's okay. You need to be more outspoken. You need to talk to them. Normally they have their ward induction days, so they will teach you, for example, what are the do's and don'ts in the ward, and where is the dialysis form that you need to have. So I remember during my first ward round, I have literally a big sliding bag, a pouch. Inside there is continuation sheets, pens, there is a dialysis paper sticker, and then there's also snacks and water, because renal ward rounds are one of the longest ward rounds. Yeah, so, but it was fun. I really like it. And I learned a lot, honestly, renal medicine does. And the first referral I've learned is basically not to be afraid of phones, generally. Not to be afraid of phones, because I was scared to speak to someone who is much more knowledgeable than me. The first referral I made was to an orthopedic. And the first question they asked me was, do you know what was the mechanics that they put into the person's hip? And I was like, what? And then I was so scared. I passed the phone to my registrar because he was literally next to me. But luckily my registrar was really nice. My renal registrar was really nice. So she taught me on how to make a basic referral. And it's not as hard as you think it is. Basically, you need to introduce yourself as I'm a foundation doctor. I've just started today. I wanted to do a referral for this patient. She was unwell for this. She was admitted for this. And today from what round we found this kind of new findings. We just want to ask for your advice to see how we can proceed with this. And is there anything that we can do on our behalf? For example, like ordering investigation or ordering bloods for you, or specific bloods that you need. So it's nice to talk, to ask them, to offer them what you can do while waiting for them to come to the ward and ask for advice. See, I told you the first acute assessment was basically on my first day as a doctor, the DKA patient. I didn't know what to do. I literally stand there for 2 minutes, not doing anything. And the nurses were asking me, doctor. It was shocking that you need to make the call at that point. But I was lucky because I have my registrar with me at that time, and the registrar office was literally behind the nursing station. So I could get the registrar to me the first time. and they were very understanding. It's nice when you have an understanding registrar, because they will not judge you, they will understand you, they will teach you. So yeah. And in terms of holding your ground here, when I say they can be a bit cheeky, they can be cheeky. They will ask you to sign certain things. So F1s, there are certain things you cannot sign. And I remember I went off, you cannot sign outpatient prescription, I remember, and they cannot do that as an F1. But I didn't know that, and I signed it, and luckily nothing happened. And I was told not to do that again. So you need to know, if, for example, a nurse came to you like, "Hey, can you please sign this outpatient?" You need to be, "I'm sorry, I'm not supposed to be signing this according to the GMC." And then you need to direct them to the person that can sign it for you. So you need to hold your ground. Sometimes they'll be like pushing you, so you need to be very firm with it, because it's not them that will be facing GMC, it will be you. So you need to hold your ground. In terms of learning your patients inside out, yes, you need to know that. I came an hour early every day for my renal walk around, because I wanted to know what my patients had gone through overnight. So renal, as I say, is they are very unstable patients. They can get really unwell within 24 hours. They can get unwell. So you need to know what happened overnight. Was there anything? It's best if you have the SHOs covering the night before, and they will tell you what happened in your ward, and then you can update your consultant because of that. And one thing you need to know about ward rounds is basically, if your ward have a moving computer, just bring that computer along, so you don't have to fumble to get available computers to check patients' blood out, because they will want to know everything about their bloods in renal, definitely everything. So it's best to learn about your patients. It's okay if you don't have the time to cover all 40 patients in the ward. It's just you need to know the ones who have something significant happening overnight. Challenge your seniors. This is what I think it is more important as well in terms of patient safety. Sometimes seniors, they overlook things, and it's okay to tell them like, "Hey, this is not right. Maybe you can look over with me and see what we missed," basically. So in terms of this, I have a story actually where I was on call and my senior wanted me to prescribe enoxaparin for a patient who had a fall and a positive subdural hemorrhage, subarachnoid hemorrhage. And you cannot prescribe enoxaparin until you're told by the neurology surgeon that it's okay for you to go ahead with that. So my senior wanted me to do it, and he's an orthopedic surgeon. So I have to "Hey, I just said are you aware that this patient had a subarachnoid hemorrhage?" And then he was like, "Oh, thanks for telling me that, I didn't know." So it's good for you to challenge your seniors. As I said, the organizing ward rounds, I had a whole bunch of things in my bag so that I don't have to run around, get continuation sheets and dialysis sheets. So it's good to have a small pouch on you to put your stethoscope in there as well. I used to use my hijab here where the pin is and put a pen in. So I have a pen here and I have a pen in my pocket. And then if someone, usually pens will get lost in the hospital. If someone took my pen, I have an extra pen here. So I normally just put it here. And then the nurses would tell me, "That's a good way to put your pens in." I was like, yeah, no one can steal that one. And in terms of grabbing as much of opportunities, is that it's really good if you can start early to build up your CV. So if, for example, you want to get into a very competitive field, for example, surgery or cardiology, it's good to start thinking what you need to do. So in terms of opportunities wise, you can start being involved in QI, quality improvement projects. And it's very good actually when you put into your CV and you can explain during the interviews on what you have done and your role. It's good also to be involved in to help out with the registrar. Can I help with the medical rotation for this ward? It shows good leadership in there. And be involved with the trust education program. For example, I was called in to teach medical students on bedside, and then the trust gave me a certificate for that. So you can put that in your CV actually, and it's very good points for you to rank up when you apply for all your post foundation programs later on. So yeah, if you can start early.
Right, sorry, Dr. Ariza, we've got another 3 minutes or so.
Okay, so sorry. And apologies. So the night shift, basically what I just want you to know is get yourself comfortable and get yourself a good sneakers. I don't care what brand is, but just get yourself a really comfortable sneakers because you'll be walking a lot. You have to have food. You really get hungry because some hospitals, they don't have a convenience store open at night. You can ask the nurses nicely to get some biscuits and paper. So yeah, and always have a pen and paper. This is important because doing the handover is so fast and there's so many people covering each ward. So you need to like keep updates with what the patients have had during the day so that they can follow up during the night what you need to do. And ASPAR is really good. I think all medical students learn about ASPAR, and you have to prioritize the acutely unwell patients first on the list. So you need to prioritize your jobs, triage, which requires immediate attention, which patient you need to get to, which patient need to expedite their investigation. If you do hold the Bleep, and if you're first to be there, don't be panic, just do your ABCD, because as a foundation doctor, you're not supposed to direct the arrest calls. You're going to wait for the medical registrar and they'll be behind you for about 30 seconds or less. They'll be there. All you need to do is make sure you have the notes of the patient. You need to have venous access to get the medication in, and you do your own first assessment first, and you let the registrar know. So keep calm, yeah. So the sorrows mean that I have a few things that were not happy. As I said, I did have a pharmacist reporting me saying that I did a negligence, but it wasn't negligence. Basically, it was like an insulin being prescribed when she has stopped having her insulin. But this was a flaw in the system. The GP didn't update. And I thought this patient was on continuation of insulin. So the first thing I had to do is basically talk to my ES and talk to my clinical supervisor at that time and see what I can do. And apparently it's just to write a reflection report and say that, oh, this is what I've learned. Maybe I have to call the pharmacist on call and see and check if there's any issues, if the patient is on the insulin actually. So it's very important to acknowledge your mistake and to talk to your ES and your education supervisor and clinical supervisor. You have a passive aggressive bullying. I do experience that. And normally it's just like making you sign things that you shouldn't sign, making you do things that you menial things basically. But normally I would just do it basically. I have a night shift from hell. I'm not gonna say that in literally, but I do have a night shift where I was an F2. So I had to cover my own wards, my trauma and orthopedic wards, and I have to cover referrals from the ED for orthopedic referrals. And at that time I had this registrar. He made me attend a trauma call and lead the trauma call. So it was just a horrible, horrible night. And one patient actually died from it. So again, I have to go through the process of talking to the ES and talking to my clinical supervisor, and actually went into the meeting with foundation director and talked about what happened actually. There were many cries. Don't worry, there are many cries, and you'll cry for 5 minutes in the toilet and you walk off and continue your job. I guess it's expected for junior doctors to be that way, but I don't think it should be that way. But there are going to be cries about things when you're feeling overwhelmed. You have the breakdown. Normally, this is the part where you break down in terms of when personal issues comes in, as well as work overload, and then you have that loneliness. And this loneliness is because I was living alone after F1. So, and it was sad because I remember that I went out for my job in the morning during winter. It was dark, and I came home also dark and to an empty house. So I just felt like it was quite lonely, and I was asking myself, what am I doing with my life? Basically, just working. Am I working towards a goal? Basically, so you have that not midlife crisis, quarter life crisis. Yeah, you have that. But you also have good days. So you have the post-call days, as I said, where you can sleep in, do your laundry, do whatever makes you happy, as long as legal and Sharia compliant. I'm a gym addict, so I always go every other day. I always arrange things with my friends or with my colleagues. I go either hiking alone or with friends, or sometimes I just join a random group when I go along the way and I met some group and I say, hey, can I join you? Normally I do that. I do have brunch with friends, and these are my favorite things, basically having brunch, because I can try out new cafes. I do update my families about things and get their support, which is very, very important, especially when you're doing a housemanship, akin to housemanship, thousands and thousands of miles away from family. So you need to have a support system. In some way, you need to have that. Oh, payday. This is the best part. Payday, I normally would travel either in the UK or outside the UK, or I get myself nice shoes, especially new sneakers, or a good book, basically, to read. And sometimes I save. I do have to save, or else my parents would kill me. As I said, support and kindness do comes in many forms. It's not just in terms of human support, but you have animal support. So sometimes I would go to a cat cafe and just enjoy looking at them, or I go to the park and just look at people and see things, observe people. And sometimes you have really good doctors and registrars, and you have good nurses. I remember I got an email personally sent to my consultant, and then my consultant called me in for a meeting and said, you got really many emails from nurses saying that, you know, you're so kind, you're up to any form of task, you're always smiling even when it's such a hard day. So it's those things, you don't see these things, but other people see it. So it was good to be, you know, acknowledged. So these are pictures. So I went to Dubai, went up to Burj Khalifa. There's my friend Farah. I think she's here somewhere in talk as well. So I went to Peak District, and I don't remember where was this. I can't remember. It was a long hike as well. It was good. I really like my foundation years. So you need to know that most of all, that everything you've done was worth it. That small thank you from a patient, that chocolate box with your name specifically on it when you walk into the doctor's office. The consultants always like to treat you with stuff like coffee and sometimes lunch, a whole pack of lunch, and all those off-peak comments as well. So these are my support system. It's really nice. And finally is my tip is basically to breathe every day, to breathe and wake up and say Bismillah or a prayer. You can take some time off. Can take some time to just get yourself ready for the day. And you have to remember that yesterday was done. There's no point thinking about yesterday. So you just learn from it and walk off. And the one thing that kept me going was that whenever I'm in a crazy position, or overwhelmed position, I would think that Allah will never put me in a situation that I cannot handle. And that this world is just temporary. The end game is basically the hereafter. So I think that's all from me. If you have any questions, can DM me personally.
Brilliant. Thank you very much, Dr. Ariza, for that very useful talk. We've tried our best to answer one question in the chat box, but feel free to ask more questions and we will leave it till the end of the webinar. Right, so shall we move on to the next speaker then? Thank you very much, Dr. Ariza. You can stop sharing your screen now. So the next speaker is Dr. Shifa Liana binti Sha'ari, and she will be talking to us about answering bleeps and prioritizing your tasks as a foundation doctor and as an intern. Dr. Shifa is a pediatric specialist trainee in the East Midlands, United Kingdom, and she also completed her foundation training in the same place. And she will be talking to us about how to prioritize your tasks on the daily as an F1 and as an intern. So I'll hand over the screen to you, Dr. Shifa, whenever you're ready.
Right, just hold on. Okay. Right. So, Assalamualaikum everyone, and good morning. It's nice to speak to you guys today. So, I've been given the task to talk about answering bleep and also prioritizing tasks. I feel like this is more like trying to teach people like how to drive a car. You can talk as much as you want, but and until you are behind the wheels on the driver's seat, and then you would actually know what to do. So I'll try my best. And also I'm hoping to do minimal talking and more of like answering questions. So feel free to jump in and ask as many questions as you like. All right, so if we go into talking about bleeps first. So bleep, so it's bleeps is essentially just a way of communication. It's just a way of someone trying to reach you, try to contact you. So we all know this is like the famous bleeps that everyone knows about, but there are many ways for people to contact you. And that could be like someone could just pick up a phone and just call you. In some hospital, they would provide you with a work phone and an iPhone or some sort of those kind that allow the nurses to message you. So you might be contacted through that, or they might just walk straight to you and speak to you face to face and ask for whatever they need from you. So there are many ways for people to try and reach you. So Bleeps is just one of the ways. So in terms of answering Bleeps and answering all those phone calls is just how you answer a phone call. So we've been so this is more of answering Bleep rather than making a referrals. All right. So answering Bleeps. First thing first, make sure that they have the right person, that they are talking to the right people. More often than not, you don't want them to be telling you about a whole history, and then at the end of it, you're like, oh, I'm covering the adult ward. Are you trying to find a pediatric ward? So, like try and save people some time on that kind of basis. So put it out there. I am the medical SHO. I am the medical F1. I am the surgical F1. I am the oncology F1. So put it out there just to make sure that they have the right person. All right. And then try to obtain a reason for the Bleep, like try to get sort of the main headline first, like what do they require from you, just to help sort of tailor your targeted your information from whatever that the nurses or the person on the other line wants. So for example, if they, for example, before they're going through the whole medical history, if they just wanted a paracetamol, they say, oh, we just try and ask them, just to be clear, like what is it that you want? So it's either do they want a review, do they just want a prescription, do they want a discharge letter? So get it out there first before you guys go deeper into the history. And then try to determine the urgency of this referral. So if they wanted a review, is it for a patient who's scoring a 2? In that case, you do have time to sort of try and get more information over the phone. But if they are saying that this patient looks really unwell and is unconscious, scoring 10 or 11 on your observation chart, so at that point you do know, like, do not sort of waste time trying to dwell into much information. Like, you do need to get the key information, but you not like in terms of their social history and stuff like that over the phone, because you're going to go and see them anyways. So it's just better to get this information face to face rather than the nurses flipping through the notes and then you're also waiting and then knowing that that patient is deteriorating at the meantime. And then recommendation. So recommendation here is like, if it's for example, the nurses want a paracetamol, so it's like, yeah, I'll prescribe it, but it might take me a few hours just because I have another things to attend to. So just say at the end of it, I'll come straight away or things like that. All right. Right. And then so that's just a bit of like just answering Bleeps. Like I say, it's just more of like as you go on, you would get your feel in terms of like what kind of questions do you need and what kind of things that, what kind of information that you would like over the phone and what kind of information that you feel like you might as well just go there and just get it face to face. So it is a soft skill. It is a skill that you will learn as you get on. And then if we talk about job prioritization, so all right, so everyone here, we've made through medical school, we've made through life. Everyone have their own sort of technique, their own sort of system in handling with daily tasks, in handling with all our homeworks and our assignments. So I'm sure most of guys would already know what to do here, but we're gonna run through a few things. So in terms of prioritizing jobs, it is different in different settings. So in hours versus out of hours job can be slightly different, and then it depends on the department that you're in, the shift that you're in. So is it a ward shift, is it a clerking shift? They're all prioritizing all these jobs can be slightly different in different shift, but of course you would as you get on, you will get a taste of it and you would develop your own system in doing it. All right. Right, so just trying to be a bit more interactive. So if you guys have your phone or another device, so if you guys go to this website, www.menti.com, if you guys would go to here, www.menti.com, and then it will ask for a code, and I'll give you a code later. So what I wanted to try and get is that so you just started your shift and you have been given these 5 tasks in front of you. All right, so the first one is Nurse Lily has bleep you for a review of Mr. A who has a chest pain. And then Nurse Joe is asking for a pain relief for Mrs. B, who has been suffering from knee pain over the last 2 weeks. And then we've also got Nurse Davina, who just come straight to you with a prescription chart and is asking you to prescribe more fluid for Mr. C. And then you also have received a phone call from the bed coordinator, is asking you to review Mr. D if he is fit for discharge. And that we have got Nurse Alicia, who also just bleep you to review a patient who was scoring a 9 on the observation chart. Right, so if we so if you guys go to menti.com and then put this code 2723957 and let me know if it doesn't work. So I'm just going to give you a few seconds to digest that. And then rank from 1 to 5 in terms of in which order would you go and see them.
Right, so Dr. Shifat, while we're waiting for people to sort out their answers, maybe you can tell us a bit more about what is the new score for those of you who are unfamiliar with it.
All right, so the new score is, so I think it stands for National Early Warning Score. So on there is basically it's an observation. It consists of 5 things. It consists of your temperature, heart rate, respiratory rate, oxygen saturations, and blood pressure. So according to this, it gives you if your heart rate is high to a certain level, it can give you a score of 3. So the higher that you score on that chart, then it suggests that the numbers are sort of away from the normal value, and it gives you a suggestion of how unwell that patient is. Right, so we're gonna give you guys just 30 more seconds and then we'll close the voting and then we'll just talk through.
One more question, but this question is just from me.
Yeah,
So how do you, what is a bleep? Like, is it, so you showed us a few pictures that what actually happens, or how do you answer a bleep?
So like I said, Bleep is essentially is a pager, is a device that's going to give you a number for you to call them back. So in terms of what to press on the phone, that differs from one hospital to another. So if your hospital is using a Bleep, as soon as you receive it, ask the person who's giving it to you what number do you need to press to answer the Bleep. Yeah, and then in terms of how to answer it, we'll go on in terms of when we talk about all these cases as well. Right. So I am gonna close the voting now. Right. So as I can see here, right, as I can see here, we've got first on the list is people are putting that they are going to review the patients who are scoring a 9 on the observation chart. And then the second is about reviewing someone with chest pain. And then third is prescribing fluids. And then fourth is prescribing pain relief. And then number 5 is reviewing someone who is fit for discharge. Right. So my next question to you is, so let me see that. Right. My next questions to you, so it's still the same. So it's still all the same questions. If you can just put in as much as you want in terms of what factors that you consider in putting on your ranking there. So you can put more than one, so feel free to put. All right, so we've got the acuteness of the scenario. So, and I've got so 2 terms of a lot of about urgency and seeing the acute patients, and then rapid deterioration. So well done. Right, so I think we're generally getting a common theme here about in terms of putting the acute patients first, putting the unwell patients first over the prescription and the discharge. Yeah, so I'm gonna close that. And let's go back to the slides. All right, so I think like I said, all of you guys have already got a feel of how do you prioritize all this stuff. So it's very common you at the start of your on-call shift. So if for example you start your night shift at 9 o'clock, or sort of at the end of the work round, you possibly could end up with like 20 jobs on your job list. And that is just that's just because, like at the start, for example, at the start of your on-call shift, it's just because all the nurses has just started their shift as well, and they are just presenting you with all the jobs that they think you need to do throughout the night. So you might have 20 jobs on your list, but that not by any means that you need to complete it within the next hour. So this is what we meant by saying that we're just trying to prioritize it to see, so that we can attend to each cases timely. All right, so as soon as when you're presented with all these jobs, take a breather. Take a few minutes to digest all of it. You do not have to react. As soon as you hear one information, you don't have to react straight away. Take 5 minutes. If you feel overwhelmed, like if you see your list is keep expanding. Like just take 5 minutes, take a breather, ask for help if you need to, reorientate yourself again. Literally, if you just need to take a step back, just take a step back and say, let the nurses know I'll come back. I just need to just reorganize my list again. And then if, for example, in that situation just now, wherever think there was a few seconds whenever people were concerned about in terms of we've got a chest pain and also patient scoring a 9, and it's only you by yourself. And if you feel that you need more help, the hospital work as a team. At night, it was never you and you alone. There's always another doctor around. There's always your F2, your senior house officer as well. And then you've got your registrar. So if you think that you are you've got your unwell patient, you've got a few unwell that you feel you can't attend them all at the same time, then seek for help early. That's always an option as well. All right, so your sheets, your job sheets, basically your job sheet, just keep it simple and keep it safe. Have minimal the minimum amount of information that you need on there is basically the name of the patient, the patient identification number. It's normally just to make it easy for you to find them in the system, the ward they're in, and then what kind of job that you need to do for them. My advice on like doing an on-call sheet, especially when you are taking handover from someone. So for example, if you're doing sort of a long day at 5 o'clock, people are telling you to chase all the blitz, chase this Mr. A, Mr. B, Mr. C blitz. Just try and prompt them one question, like, why did you do the blitz? Just so that you have a bit of context. So for example, can you chase his blitz? It's just a routine blitz, so you know they're not concerned about this patient. And then if, for example, someone have, can you chase the UNEs because patient is in AKI and is on IV fluid. So you do know that you need to pay a bit more attention towards the UNEs on this patient. So try and prompt whenever people ask you to chase something, just give them a nudge in terms of why did you do it. So if people is asking you chase a chest X-ray, or why did you do a chest? Why did you do a chest X-ray? What was it that you're concerned about? Right. So prioritizing jobs. So like the field that you guys are getting is now, like everyone was putting like put the unwell patient, who you would like to see the unwell patients first. And then so job prioritization here, like I mentioned, it can be different from whenever in hours and out of hours. So if you're sort of doing at your 9 to 5 at the end of work round kind of job, so try and put in the investigation request early so that it can happen sort of earlier on in the day. And then referrals as well. Try not to leave speaking to, for example, you're referring someone to orthopedics, try not to leave it sort of like at 4:30 just before you finish your shift, because that person is also just finished their shift, so they might not come promptly or things like that. So try and put that out sort of earlier on. And then discharge letters. So discharge letters, when you work in the hospital, I think there's gonna be a lot of stress being put having the discharge letter done early. So it's normally discharge letter, you do it in sort of your in-hour kind of shift, and during that time, there's normally more than one doctors covering the ward. So it's all about trying divide and conquer. So one person can do all this investigation and referrals, and the other can start doing the discharge letter. So like I said, it's not all on you. We all work in a team here. And then preparing discharge letter is sort of like quite the bottom. Preparing, what I meant by preparing is like if you are foreseeing that this patient might be discharged in a day or two, and you already finish your job by 4 o'clock and just waiting to hand over things like that, then you can look about preparing discharge letter for patients who you think can go home in the next day or two, and that's just going to make your day much easier as you get on through the week. And then, for example, in the case just now, you were presented by 2 unwell patients. So you've got your patient who's scoring a 9, and you've got your patients with chest pain. So at this point, to try, because you've got 2 patients in front of you, try and gather a bit more information to see which one you need to see before the other. So the gather more information is more just the key information. So for example, that patient who is scoring a 9, you can ask, is this what was this patient scoring before? For example, I've had patient who was scoring a 9 since the morning, and the patient was already sort of in palliative, and people are expecting that patient to deteriorate in the next few hours. So you do know that, all right, this is not something acute that just happened within the last hour that the patient suddenly deteriorated. The patient has been deteriorated since the morning. So it just gives you a bit of leeway. It doesn't mean that you don't need to see the patient, but it just gives you a bit of more information there. And then, for example, the patient with the chest pain. So this chest pain, is it sort of like a crushing central chest pain, or is it the patient was just a bit more discomfort? Is this new for the patient? Is the observation stable? So if this is complete new for the patients, and patient, the blood pressure is dropping, heart rate is going up, then you know that, oh, that patient is acutely just having this acutely, and you might need to see that patient first. Those are just a bit more information just to try and determine the urgency of it. But as I say, if you feel like these 2 is really unwell and you can't attend them at the same time, call for help. Whenever you start, at which point you feel that you need help, just call for help. There's no wrong in calling for help. Do not doubt yourself for needing help. And then in the meantime, you can buy sometimes, in terms of while you're going there, the patient with chest pain, you can ask the nurse to start doing an ECG while you're getting there. And for any patient with pain, just consider giving them pain relief just to help with your assessment as well. And then my last bit is about just learn, observe what other people do, learn from them, and reflect. Your first month, your first few weeks, you feel overwhelmed, but it's mainly just because we don't really know the system. But once you get all these tricks, tips and tricks, you've mastered all of this by the first few months, you'll be flying through your F1 and your internship here, I'm sure. So yeah, that's it from me. I hope that's helpful in any kind of forms, and I'm open to any questions as well.
So we've got another 5 minutes for any questions, so feel free to drop your questions in the chat box, and then Dr. Shifa will answer them accordingly. In the meantime, just to share, Dr. Shifa mentioned about something about knowing your limitations as an F1. I think I remember during my first shift as an F1, I didn't know what to do about an AF. I saw an ECG, I knew it was an AF, but I just blanked out. So I think I agree with what Dr. Shifa was saying. Like, if you're stuck, even the most mundane things, medical registrar is always there to help you out. They're just a bleep away. And I definitely agree with what Shifa said about knowing your limitations and escalating as well if you're not sure. Any further tips about accepting handover from our colleagues? Because I know from our own experiences, we've received many sort of I would call them ridiculous handover at the start of our shifts. Is there ever room to say, no, this can wait until tomorrow? What do you think?
Well, like I feel like that those kind of things you learn as you go. Definitely in our first few months, we just accept all the handovers there is. Um, you know, people are handing over jobs from ward round, which is very like non-urgent. Um, so that's when your prioritizing skills come. So you would learn as you go in terms of does need well, if you do have time, just do it, but then like don't really not do it just because you don't think it's urgent. Yeah, because like it will just, like I said, we all work in a team. It helps everyone. And then another thing about whenever you're doing a job, I find that try to minimize your distraction. You would, especially if you're doing a prescription, you often find as you're doing it, and someone will come, just by the way, just want to tell you this, by the way, just want to tell you that. If you're focusing on something, try not to take a message or anything like that. Just politely tell him or her, just say that, oh, I'm just doing this, can you just give me 5 minutes and I'll come back to you. So if you're doing one thing, don't try to multitask and try like getting all the information at the same time as well, because that's when you would miss things. So if you're doing one thing, focus on that and then move on and then move on.
Brilliant, thank you. We haven't got any questions in the chat box, but maybe just one last thing. So you told us about prioritizing jobs, but are things like rest and, actually having a chance to go to the toilet, is that a priority? What do you think?
Yes, so that is definitely a priority. So if like so like I say, if you presented with commonly, even at the end of a walk round, we would even, and you have 20 jobs on your list, commonly what people like to do is just step away from the ward, go for a coffee with your colleague, because sometimes walk around can be draining already. So at the end of it, at the end of the walk around, go grab a cup of coffee with your colleague, go have a nice break, and then go run through your job list together. And then that's when you can nicely divide and conquer. And like I said, this kind of things, my first month, whenever you presented with all these 20 jobs at the end of a walk around, it can be overwhelming, and you feel like, do not put yourself down. It's more of just we haven't get in control with the system yet, rather than your incompetency yourself. It's always not about that. It's just you haven't got hold of the system yet. Once you get a hold of the system, you'll be flying. Like you'll be learning more, rather than just focusing on just doing all these tiny jobs that you need to do.
Brilliant. Thank you very much, Dr. Shifa. And I think that marks the end of that talk.
Yeah, thank you, everyone.
Thank you very much. So our next speaker is Dr. Munirah. Dr. Munirah, are you ready? Can I just have a quick look and see whether she's already here? Brilliant, and she is ready. So just a quick introduction about Dr. Munirah. Dr. Munirah Ibrahim has completed her GP specialist training in South Yorkshire, United Kingdom, and she has a special interest in community palliative care, which is interesting. And at the moment, she has kindly joined us from Malaysia and currently working at Kasih Hospice Foundation in Petaling Jaya, Selangor. And Dr. Munirah will be sharing with us about faith in medicine. And from my understanding, there's quite a diverse crowd here today from many different backgrounds. So hopefully you will get some benefit from this talk. So I'll hand over the screen to Dr. Munirah whenever you're ready.
Thank you very much, Azlin, for the kind introduction. Assalamualaikum and good morning to everybody in the UK, and good afternoon to anybody in Malaysia with me. So inshallah, I will be talking about faith in medicine. And to be honest with you, I was a bit worried that I'm not sure whether I am fulfilling what is expected of this topic, to me, I mean, it's a great topic, and I'm hoping that it will be useful to everyone, despite your faith backgrounds. But at the end of the day, I mean, at the end, feel free to tell me, and hopefully as we go along, maybe we'll have questions that we can discuss about this topic in particular. Anyway, it's nice to see everybody, some familiar faces. I mean, I've never really felt like I've left the UK, so I always feel part of me is still there. All right, so I am going to share my slides, just bear with me. Okay, can you see the blue slide, Faith in Medicine? Yeah?
Yes.
All right, okay, thanks very much. Okay, so essentially the questions that maybe we can ask ourselves today is, what is faith? And how important, and faith to different people might mean different things. For some people, faith or religion is different from spirituality. For some, both are the same. For some, they may be spiritual, but they do not subscribe to a particular religion. So the question is, what is faith? And the second question is, how important is faith in our life? So again, for each and every one of us, this may vary to different degrees. The third question is, what are the challenges of practicing our faith in a Western society? And obviously, this is a question that I pose specifically for those of you who are already in the UK or are going to the UK and maybe have some perceptions or maybe some anxieties about what this may mean for those of us who practice our faith and going over there thinking that we are a minority over there. How will it affect us? And also, what do you expect from this session today? So before we start, I am going to ask you, everybody, if you could open slido.com. I'm going to make this a bit interactive. Hopefully nobody will fall asleep. Okay, so the number, if you have opened your Slido, right. Okay, so the number is 228458. Has everybody got it? I'm hoping, please voice out if you're not ready yet. Yeah?
Yeah.
Okay, so slido.com 228458, okay? So I'm just going to ask you a few questions. It's completely anonymous, so feel free to just enter whatever. Okay, so first of all, how are you feeling today? You can really literally answer anything to that. Bored, excited, tired, or anxious, okay? You've had, I think, some quite intensive talks. Energetic and positive, good. Alhamdulillah. Yeah, expected, yeah. So I think it must be quite a heavy session for all of you, and there's quite a lot to expect, I think, in the coming few months. All right. If there's no more coming, I do expect more though. Nervous but good. How many have we got today? I mean, I can see 33 participants. So okay, I'll move on to the next question. If any of you have problems getting on, but it'll be good to have you on board as well. All right. So next question. What does faith mean to you?
Dr. Munira,
Again,
do you mind sharing your screen, please?
Oh, sorry. Oh, yeah, sure. I'm so
Thank
sorry.
you.
Let us, that would be helpful. Thanks. Okay. Right. No wonder I was talking to myself. Right. Okay. So, so yeah, we've got some tired, nervous but good, anxious. So some neutral. Okay. Right. So next question. What does faith mean to you? Again, don't worry about being correct in this. no right answer really. It can mean anything, it can mean nothing, or you can be not sure. Okay, so some have answered core value, purpose of life, belief in fate, trust in someone, something to fall back on. Something you hold on to. Okay, assurance, guides to live my life. Trust. Okay, maybe we'll go on to the next one. So as you can see, these answers, really pose a core concept in our lives, doesn't it? It's something that, we hold on to, it guides us, it's giving us something to fall back on, and therefore it's really important, yeah? Okay, we'll move on to the next one. What challenges do you expect with regards to your faith and working in the UK? Minority, adapting to the system, praying in between jobs. I think maybe this has been covered in some of the previous talks, a different culture, alone, emotional burnout, pray on time, language barrier, difference in views. Good, these are all really, really, important and significant answers, and there's nothing that's not significant really. Live halal, respect new environment. Yeah, so obviously you would expect some challenges, yeah? I mean, maybe for some, if you're used to it, or homesickness, yeah. So that you've a lot of emotions to deal with, besides having to adapt to an environment that's not similar to Malaysia, to what we're maybe used to, or maybe where we are majority, or maybe people don't question our faith, and so there is some anticipated anxiety, possibly, maybe even to a small degree, as to how it'll be over there. Yeah. Okay. And what are you expecting from this session? Now, this is really important to me because I'm worried I go off track. So feel free to say again, whatever, and I will try to accommodate accordingly. I'm hoping there's some expectation, maybe zero expectations. Okay, that's maybe good also. How to organize myself, implementing faith, tips on maintaining faith, learn the importance of faith, not forgetting God, managing the break, pray, eat, so how to incorporate in work, yeah? What to do for FY2, okay? I'm not sure, well, depends how you see it. You might get some inspiration. Okay, I was thinking maybe let it reach to 10 if there are any more. Move on in doubtful times. Okay, yeah, there's a lot of, with the current pandemic and issues within the country and internationally, there are many doubts about, what the future holds. But To a certain extent, some are out of our control, and some are, we can do something about. So, but again, faith may help with that, or we hope will help with that. Yeah. Mental health tips. Okay. Right, waiting for 2 more if there are any more coming. Organizers, sorry, how long do I have till again?
So that would be around 10:30 or so, but we will have a break right after this.
10:30 is 6:30, is it?
So that would be
yes.
in 13 minutes time. Yes.
13?
Yes.
Oh, that's very short. Okay, I better move on then. Okay, fine. We'll not wait till 10. Right, okay, thank you very much for that. Let us stop there and I will go back to my slides. All right, I'm going to have to rush through now. I thought I had more time. Never mind. Right, okay. So we've asked some questions. How do we incorporate faith in our medical profession? Okay, now this is going to be a bit of a personal story, but I just thought that I mean, I didn't want it to be like, so theoretical, and maybe just share my journey, and hopefully it may be useful for others. Anyway, does anybody recognize this place at all? Only newcomers allowed to answer. It looks like Hogwarts. Anybody know? Okay, so this is University of Glasgow. That's where I did my undergraduate degree. And then I did my F2 in Birmingham, Heartlands Hospital and Walsall Manor Hospital, so in the heart of England NHS Trust. And then I came back to Malaysia and started my family medicine training in UITM, and then went back to the UK for a second time. Started my GP training basically under Rotherham NHS Trust. Went to Rotherham General Hospital for some of my rotations. This is Stag Medical Centre on the left upper corner and Brinsworth Medical Centre on the bottom. And my most favourite place is Rotherham Hospice, where basically I found palliative care, community palliative care, and fell in love and ever since. So that's what I am doing today in Malaysia. Now, I'm sharing this partly to say that, I didn't always right from the beginning felt that I could confidently incorporate faith into my work. And when I say that, meaning not that I didn't practice my faith, but maybe I had doubts or I felt inferior, or I felt that, I couldn't, it was something that, I just had told personal to myself. It's nothing to involve other people with. But along the way, it's a journey, it doesn't happen overnight, but as we go along and as we realize, or as I realized how important faith is to me and how important it is also to uphold your faith with other people, then, I felt that it started to help me develop further, not just in my personal sphere, but also in my career. My presentation is just full of pictures, so bear with me. So on this left is my supervisor, Dr. Qureshi, and she was like a big sister to me. She was basically, from I started training till I finished training, and we were so close to the extent that, my mom went to her house, and, my kids remember her till now. So amazing supervisor. Up at the top right-hand corner is Brinsworth Medical Centre. So, joined in their celebrations, but at the same time, respect, this was a Christmas dinner, respecting other people's celebrations, but at the same time maintaining and upholding our own faith and our own boundaries in our communications with others. At the bottom right hand corner, this is the Malaysian Society in Sheffield. I'm at the right at the very end on the right, and this was the one event where I was involved in organizing the Hari Raya over there. So for those of you, Hari Raya actually over there can be more meriah than in Malaysia. So hopefully something for you to look forward to. But just to show sort of involvement in the community that can help you flourish as a person and still hold on very strongly to your faith. Now, this is Rotherham Hospice, and all these people here are non-doctors. So top right-hand corner, these are all the kitchen staff, and they make scones for me and give them to me free. Top left-hand corner are physios and social worker. and OT. Bottom left, this is the cleaners, the nurses, and then bottom right, that's she was one of the admin staff at the front desk, but now she's done her nursing degree and just qualified as a nurse and back in Rotherham Hospice as a nurse. So I just wanted to share about building lasting and good relationships with the staff. They, you get along with them, they will, make your life much easier. And it's just nice to have people that you feel like, it's like family. It's like going to work to friends, rather than just merely staff. And this is actually my farewell. On the last day of hospice, I just really didn't want to leave, but I had to, didn't have a choice. So I tempan nasi ayam, so I asked them to taste the Malaysian cuisine, and they were all like, they don't know, I didn't know, they're not used to having what they call it, a buffet style, So I had to tell them how to cedok the nasi and put the nasi and the ayam. But anyway, they enjoyed it, and I even sang a song basically that I made and for them, and they now have the song up in the prayer room in Rotherham Hospice. It's up there on the wall, and it's a prayer place, and there are some even Muslim books now that I contributed to the collection there for religious purposes. So this on the top left is nurse who I keep in touch with most of them now till now. She made a bag for me, and on the bottom right hand corner that was farewell at Rotherham Hospice, and the bottom right hand corner is farewell before I left UK for Malaysia, and that was like 1.5 years later. So we still keep on contact till now. So I'm saying again, build good relationships, and it doesn't mean that you have to compromise your faith in any way. And in fact, the more you are confident and uphold your faith, people actually respect that. And sometimes it's actually our own fears that become barriers to other people and understanding our faith. And one funny story I wanted to, as you can see, I wear quite a big tudung, and I kind of assume that, people know, must know I'm Muslim, right? Because like so obvious. But actually one day, one of the staff asked me, Siti, they call me Siti, is my first name. Siti, I just need to ask you, are you Muslim? I just wasn't sure whether to laugh or to cry, or I was like, oh my goodness, it's not even clear to, the people around me that I'm Muslim. I didn't mind them asking, but again, they were comfortable enough to be able to ask me. And it made me realize that, it's not enough to assume people know about our faith, but to be able to talk to them about it, to make them comfortable enough to be able to ask us, and break the stereotypes and also the propaganda, the Islamophobia. And the only way to do that is to be an ambassador, to show what Islam is like. And when I'm talking about Islam, I'm talking about my faith or whatever faith you hold on to. So be confident, share, be open, be accommodating to questions, and hold firm to what we believe in. And actually people do respect that. This is basically on the top right-hand corner, we got involved with the hospice charity run. So I got all my kids to come, my whole family to come along and, raise funds for Rotherham Hospice. Bottom right-hand corner is my study partner. She's, so if she's from the Philippines, she's Christian in background. So, we had lots of discussions about faith, studied together, and got through the exams together. And on the left is my trainee. She's a support, she supports all of us. And basically this was when I was awarded the Chavez Amin Community Spirit Award, something I would have never, I started off quite a timid person who kind of just, stay in the background, didn't really want to be involved. And in the end, the pressures, and also again, as we grew or as I became more confident in my faith and understanding of my faith, it helped me to, gain more in my interactions with others as well. And this is just to share that I very frequently give gifts to people. I just love doing that. And when I say this, you don't have to follow in my steps, but I just share it as maybe ideas for you to think about. So this I give every year, this cake. It's a cake campaign during Ramadan, and we do it for charity. So if you buy the cake, the money goes to charity. So I'll buy one for Rotherham Hospice. I'll buy one for the children's school. I'll buy one for the ward wherever I'm in at that point in time. The dates for orphans, and I drew this picture myself, and I would write, this cards to give out to them. And in a way, it's about sharing about what Ramadan is. It's also, you know, a sort of expression of love or care for other people. And it's also a reason to go and meet people again. It's like, oh, I'm back, I'm just bringing cake, you know. Food is always, you know, it's like Malaysians too. Food always goes down well. And in the UK, you know, everything is so cheap and yummy. So, you know, make use of that. And I sometimes buy pens, you know, pens like, you know, pens are always useful. Everybody needs pens on the ward, right? So, you know, they don't even have to be expensive, but just something that's right from your heart and for people to remember you with. So again, small things that can go a long way. This is me celebrating Ramadan and telling everybody what Ramadan is about. So I prepared these little biscuits and, you know, made these little stickers to put on them and give them out to everybody in the ward. Again, just ideas for you to feel that, you know, there's so many ways to be creative and confident and just be happy to share about your own faith with others. You know, some people don't even, I had people asking me, oh, I thought you fasted like literally for the whole month, meaning that you didn't eat from first day till the 30th day. And I'm like, wow, okay. So, you know, to again, break those misconceptions, but at the same time, knowing that you have to, you know, portray a good image, you know, that even though you're fasting, you're still performing as anybody else will do. Even if you have prayers, it doesn't affect your punctuality to meetings or your work. So it makes you actually more disciplined, because while others having a cup of tea or, you know, maybe sembang-sembang over food, you are using your time well, because you know, you're not just going for lunch, but you also have to go for prayers. You also have to, or when you're fasting, maybe when people go for lunch, you have a quick power nap so that you have enough energy to last the fasting hours. So it actually makes you more disciplined, knowing that you have to kind of, you know, keep your performance on track despite, and it shouldn't really affect if you think of it that way. I also specifically made a Facebook page just for my colleagues, because I wanted them to know about Islam, and I would share things like the things that I did with my children, you know, Ramadan cards and whatever we did at home, and good deeds jars, and we did programs about I love Prophet Jesus. And I thought, okay, maybe that would, you know, be familiar with some of them in terms of their belief in Jesus, and just share it, you know. And again, it can be points for people to either read about it or ask us about it, or even just know that, oh, hang on a minute, like, you know, Siti believes in these things. And it's very, you get mixed reactions really, because one of my senior colleagues who I got along quite well with, and, you know, in the pediatrics rotation, one day she asked me, she's like, Siti, I can't believe you're actually subscribed to these things. I thought you are progressive and intelligent. And I'm like, wow, I really didn't expect that coming from her, because, you know, we were quite close, and yet she felt I was backward because I had a faith. But I felt that it was, I mean, it took me a little bit by surprise, but at the same time, it's like, it's interesting to understand how people perceive people of faith. And, you know, in the Western society, I feel that in the Eastern society, especially in Malaysia, we are still very strong in our faith. And that's something that I feel is our strength as opposed to our weakness. And, you know, Western society don't necessarily understand that. You know, if sometimes, in fact, to talk about faith is like, it's like a no-no. So why not, you know, share with others about our faith, as long as it doesn't you know, interfere other people. And this is just to share that there was one time where I was really stressed about the immigration health surcharges. This was about May 2019. And it was, I basically managed to bring the issue to the Guardian newspaper by, this was on the right is the main article, on the left it was kind of focusing on my story. And this on the left upper is Julia Grace from Every Doctor, who basically, I managed to get in touch with her after trying, you know, the British Medical Association and a few other agencies who really weren't really, you know, didn't really care fully about the issue. But Julia, she helped to put this in, you know, really fight for us. And that's why today, Alhamdulillah, as of May last year, the immigration health surcharge has been scrapped, you know, to a significant degree, and visa charges have reduced. And just to say that, again, you know, there's no reason for you to not be able to achieve what other people are able to achieve, you know, being abroad, being an immigrant as such. You just, you know, again, it's about our character, how we communicate with others, how we portray ourselves, and actually you can achieve great things. You know, so be confident and have that, you know, that just have the confidence that the confidence that you can actually be at par. I mean, I say that because at one point I felt that I was always inferior, and that's why I want to share with you that there's no need to feel that way. Actually, it's actually our own feelings that hold us back. And on the bottom left corner is actually a session that we had with members of parliament to explain to them about the immigration health surcharge and why it should be scrapped altogether. So it really went far with that. And I mean, alhamdulillah, it was all obviously Allah's plan for all that to happen, but just to share that, this was something that I experienced. And Julia then shared in our group of doctors that, when the immigration health surcharge was scrapped, that she kindly made this acknowledgement to me and all the work that we did behind it, which, she really contributed to. Now this one's, I think the organizers have shared this with you. I'm aware we're past time now, sorry. I'll try and just run through it. So you have the presentation with you, but this is what I decided to do when I was in the hospice, because I realized that, we had Muslim patients in the community and also in hospice, and the nurses may not know how to care for a Muslim patient in ways that are different from other patients. So I thought maybe this is a good chance, to share about what could be different in a Muslim patient, and also at the same time to explain about Islam in case, there are any misconceptions. So if you go through the slides, which you can do in your own time, I explain who is a Muslim, the 5 pillars of Islam, and why these things might be important to somebody who is dying, who is, has a palliative, has a terminal illness, but still wants to go for Hajj or still wants to do the prayer because it's so important to somebody who's Muslim, about death and dying, particularly in palliative care, and what differences that Muslims might have, about concepts of pain and suffering and our different diet requirements, about modesty, because if we either go to, or nurses go to the patient's house, or the patients are in the hospice, they may be particular about covering their hair, covering their body, or having male or female staff attend to them. And again, it's just, and actually the staff, they don't mind. They actually, it's just that they didn't know these things. So explain the concept of awrat, and also prayer and how that is important to us. And also basically told them how, if they were to help a patient to take the ablution, this diagram I drew for them to understand when the prayer times are, how they can help with somebody who would like to pray. And in the hospice, I found out which rooms had beds that were already facing the Kaaba. So the Qibla, so that, they knew they could put Muslim patients in these rooms rather than having to, change everything around. So that was, hopefully helpful to them. And then also explaining to them that actually prayer can be done even while lying down if the patient is not well enough, or even with eye movements, and also rituals after death. And the reaction that, I got, I was quite anxious to present this because I'm thinking, what on earth will people think I'm talking about this in quite detail? But I really thought it was important to know all these things. And they were just amazed. They're like, Siti, we've been looking after Muslim patients since a long time, and we've never known any of this. And actually we're afraid to ask the patients themselves because it's such a sensitive topic, and thank you. So now we know that, and I had, after I left the hospice, one of the consultants called, Siti, which room is it again that, which room is it that's facing the Kaaba again? Can you tell me? And, so never underestimate that actually people do want to know about our faith, that sometimes, the propagandas and the Islamophobia makes people think, or, they just have really odd perceptions, and it's not their fault, nobody's ever explained to them. And therefore, it may be our place to do so, to explain about our faith to other people, so that, there was one occupational therapist who always, looked at me with, funnily. And then one day I asked her, is everything okay? And got into a conversation, and she just said, I have to ask you, Siti. So I'm Christian, and I read everywhere that, you are, as Muslims, you're allowed to kill us. And I'm like, no wonder she looked at me so funny. She's thinking I'm trying to kill her. But anyway, you have these extremes of thought, and we got into a conversation, and, we made good friends after that. So communication is really important. So that was one presentation which I did for the hospice, and I also shared it with my GP colleagues for their training as well. And also this other presentation on diabetes and Ramadan, again, for my GP surgery and for the GP trainees. Again, it's something that, people don't really, maybe don't know where to ask. So thinking, this might be useful for doctors, useful to help our patients. I was also involved in the British Islamic Medical Association, or BIMA, in doing the talks in the community out in the mosques, talking about diabetes, cancer screening, and depression. So what is the take-home message? Basically, be kind to everyone we meet, really just everyone, build, oh, sorry, that was meant to be before that, but after that anyway. Be sincere, build lasting relationships wherever you go. And this will keep you going actually, and give you actually, to me, it gave me the confidence to continue being who I am, and to feel confident in bringing my faith wherever I go, because people then look beyond your physical appearance or what they perceive. You are more to who you are as a person, and your heart. Be involved. Sometimes we tend to dissociate ourselves from activities with the local community, so get involved. Show that you care and you want to contribute. Be proactive. So find opportunities to create awareness about our faith and create positive change. Think about how can I, what can I bring that's that's not here yet. Think like that everywhere you go. And also, I also try to think, what can I bring back to Malaysia as well? When you come back. So it's kind of it works both ways, that you can leave marks wherever you go. Be courageous. So when it's time to speak up, do speak up. I mean, this was terrifying for me, but at that point in time, it was really, it was just awful. I just felt so angry, so frustrated that at that point in time, I felt, what could I lose? I'm going to finish my training. If I speak up and I get, thrown out of the country, I mean, I'll go back to Malaysia anyway. But this can benefit so many other people. So I just took the chance. I mean, you may not have to be this big, but meaning that, speak up. When I was in the pediatrics department, I fought for, again, it was because, probably because I had no choice. It was either drown or just swim at that point in time, where we were down in so many doctors that we were all just at the verge of quitting. I was at the verge of quitting. And I felt that I had to speak up. I had to stand up and do something about it. So we kind of revamped the whole, what do you call it, rota, so that everybody could survive it. So what I'm trying to say is, we can speak up. And I'm not saying that with, it was terrifying for me, but actually, you can create change. So think of ways to work around things when things are not going accordingly, and be confident, have pride or izzah in our faith. Don't feel you have to compromise anything for other people. Don't feel you have to give in to what other people expect of you, but actually show that despite your faith or with your faith, you are, you are an amazing person. It's not something, it should be something that makes you an amazing person. And so we are really an ambassador of our faith everywhere we go, and just hold that true to ourselves, and use that as a reason to shine wherever you are. Be principled, hold on to our faith principles, be knowledgeable, so that when people ask us about our faith, we can answer and share, and also be approachable, so that people find that they can ask us about our faith and learn more about it. And just lastly, to finish off, is the importance of a support system. So this is me with IKRAM East Midlands and South Yorkshire, which no longer exists now. It was in our time, but so IKRAM, who are organizing, the IKRAM UK, who are organizing this event today, that is my big support system, where I learned about my faith. I had friends who felt faith was an important part of their lives, and it became, so that was really important for me. So for those of you who are interested, can approach the organizers later. And the left is just the award that I received at the end of my stay in the UK from IKRAM UKE. And so this is the verse from the Quran, one of my very favorite verses, from Surah 49, Hujurat, verse 13, O mankind, indeed we have created you from male and female and made you peoples and tribes so that you may know one another. Indeed, the most noble of you in the sight of Allah is the most righteous of you. And this, I love this ayat, because basically, we are all here on this earth made to be different, made to be of varying faiths and race, and just different, so that we can know one another. And it's really a truly amazing experience. And I hope that, all of you who get this chance to go abroad, please use it to really enrich yourself with that experience, and come back being a better person, bringing better things for Malaysia. So that's it from me. I'm sorry, I've gone over time by about 11 minutes.
No, that's completely fine. It was a very interesting topic, actually. So based on the program, there is a short break. However, we have one question by one of our participants, if that's okay. So the question is, can we participate in local help groups irrespective of our background? So that's from one of our participants.
Local help groups. I'm not sure if you're referring to anything in particular, but I don't see why not. At one point, I was involved, and this was when, there were peaks where Islamophobia was, there are peaks of Islamophobia, basically. It's usually when an incident happens that, they say terrorists, Muslims, blah, blah, blah. And then it coincided with an open mosque event. And I went to it, and basically some of the people that I met there were from the church, and they were like, we had a chat with them, a really good chat. And they're like, can you come to our church and tell our church people that? Because, we understand that. And, we're amazed by your efforts today, but the rest of the church team thinks you're all like, terrorists. So can you come? So why not? As long as you understand, as long as we understand. And this is why it's important to have that knowledge of so that actually we shouldn't be afraid of anyone or anything. Obviously be safe, try not to go alone and go with others. But when we are, this is something I hold very dear, even here in Malaysia, where, there's a lot of racial tension, a lot of interfaith tension, that actually there's nothing to fear about other faiths or other races or other backgrounds. It's how confident we are in our own. And the more confident we are in our own, we can mingle with anyone. It doesn't really matter. Even if you decide to go into a pub, if you're not going to drink and you're not going to be mixing around freely, there's no issue with that. So it's about knowing your boundaries. It's about knowing what your intentions are by doing that. It's always about knowing that, again, you are an ambassador. You are bringing Islam wherever, whether you like it or not, you are an ambassador of Islam. And so I think that I totally believe in creating bridges. So sometimes it felt so disappointing and just frustrating when the peaks of Islamophobia happen, and you're just thinking, what are people thinking of me? You feel like you always have to prove yourself. But then I just turned around and told myself, change it, be the reason for people to believe, hang on a minute, Siti's Muslim, she's fine, she's a great doctor, she's a great friend, she's human, and that's why I share on my Facebook, me being a mother and my children, and it's like, they can see I'm a normal human being, having normal daily activities, not creating bombs in my house, so you have to be conscious to a certain extent about doing these things, because when we realize we are an ambassador wherever we go, it's important what kind of impressions we create. So I would get concerned if my Muslim colleagues, and I did have Muslim colleagues who swore when they talk, and I just felt like, can you please not do that, because it's as if the rest of us are like that, and we become more conscious in our character and how we bring ourselves, because at the end of the day, it will create an impression on other people. But at the end of the day, it's not to do it for other people. It's actually, it makes us better. We're always thinking, okay, if we do this, what will people think? If we do this, is it negative or positive? But it's not to do it for people. It's more to think, as a Muslim, should I do this? As a Muslim, I'm sorry, this also applies to other faith, but personally, for me, that's what I would think. As a Muslim, is this a good thing? Is it a bad thing? What people think of me as a Muslim? And how can I share about my faith so that people are, no longer scared of Islam and actually maybe more interested to find out more. So it's basically, sorry, that's the long answer to yes, you can.
Thank you very much, Dr. Munira. Just to let you know, there's been a couple of comments with regards to your session. One of our participants mentioned that they've really appreciated everything that you've done, as well as what our forefathers, our mothers have done in the past as well. It's very inspiring. Another participant mentioned that you're always an inspiration to us. And alhamdulillah, now there's no longer NHS surcharge for all international doctors. So the small things can really make a big difference, as you've proven to us. So thank you very much, Dr. Munira, for your sharing today. I'm really sorry that we've had to cut your session short, but hopefully we can organize another talk in the future, inshallah. Thank you.
Thank you so much for having me. Thank you, everyone. All the best.
Thank you. Right, so to all the participants, we do have a short break until 11 o'clock UK time. So that will be 6 p.m. Malaysian time, if my calculations are correct. So we will meet again in 15 minutes and we shall see you then.